So a 19-year-old college student comes to an urgent care clinic after having developed whitish discharge in his eyes this morning. The patient's personal medical history is unremarkable. He does not smoke or does not drink. He's going on to white discharge and conjunctival injection bilaterally. So take a look at that picture. So here you can put 2 and 2 together. Okay, you have a white discharge, lots of pus. Okay, it has to be an infection. You have bilateral injected conjunctiva. What is the difference between this and a hordeolum, a sty? They're both infections, but how do you know what the difference is? Yeah, absolutely. Well, if it's conjunctivitis, you have bilateral injected conjunctiva. The conjunctiva is being affected. In hordeolum, who's being affected? In general, the eyelids, right? And there you would not see as much conjunctival injection. All right, both infections though, but that's how you want to differentiate. So this one was viral, this is bacterial. Now, a college student visits a campus clinic in the spring with the complaint of bilateral itching, watery red eyes. See, you will see that all 3 conditions, bilateral, itchy, injected conjunctiva. The student states that she has a history of intermittent asthma, has recently needed the use of albuterol meter-dose inhaler for a mild flare-up. On examination, she has bilateral chemosis with large cobblestone papilla on the upper tarsal conjunctiva. So be careful here, because what did we see earlier as far as upper conjunctiva? That possibly could look like this. Yeah, chlamydia, the trachoma. But those were what? Those were follicles. This is an allergic reaction. This is allergic conjunctivitis, asthma, right? You have an allergic process which is taking place. And think about it. When you have an allergic reaction, what is going on with the body? Whatever part of the body that it is affecting, you're going to have inflammation. This is cobblestone type appearance. If it's follicles, you're not going to see that bumpy type of appearance. So be careful with that. Read the question, put everything together. Take the picture, take a look at the stem. Does it make sense? The USMLE is a great test, it really is. I mean, it's challenging, yes, but it makes sense. And as long as you're able to pick it apart, then you'll do fine. All right, now, still with the conjunctiva. We're done with the conjunctivitis. Let's go on to the pinguicula. Now, for the most part, there are 2 conditions that are benign. Okay, both of these are benign. And the process is relatively the same. However, the presentation is the only thing that's different. Okay, pinguicula is basically a fatty change, but please, that's what it means, and it's a misnomer. It's not fat. Okay, the last time we saw fat was xanthelasma, and that actually was foamy macrophages. This is pinguicula, and I wish they would rename it, but it is what it is, and it is yellow. Okay, and it's usually some irritation to dust. Not exactly know. They don't exactly know as to what causes it. However, rubbing of the eye possibly. But the point being is even UV light. And then here you will see this is not fat. This is not a xanthelasma. Not to mention, xanthelasma would not appear on your conjunctiva, would it? No, absolutely not. A xanthelasma would be up here. So this is a pinguicula. It's basically the connective tissue which is being disrupted. Connective tissue of what? The conjunctiva. Okay, that's a pinguicula. Once again, fatty change. Degeneration, conjunctival tissue. Degeneration of fine, I'm reading the bottom, nearly transparent conjunctival fibers. So you're looking at the connective tissue disruption. What causes it? Well, dust, just common things, exposure, stuff like that. The other condition that we'll come to in a second, pinguicula, benign connective tissue, will appear yellow, and the other condition will be pterygium. All right, the way that I want you to remember that, a pterygium, a pterodactyl. All right, pteri means wing. Okay, you need to remember that so that you can differentiate one from the other. What's the process? Once again, disruption of connective tissue, but what did I say? The presentation is going to be different. Pterygium, benign growth, it's an allostatic. All right, what does ellastotic mean? It's elastic. This one's going to grow. We're still in the conjunctiva. It's going to grow, and we'll see as to how it grows in a second. The reason I have these individuals, well, all these individuals are exposed to sun quite a bit. NASCAR, if you're a NASCAR fan, there's Alberto Tombo if you're a slalom skier, surfer, and I see a bunch of you out here every once in a while, so it's kind of cool. And there it is, pterygium. See that wing? Here's the head, the point of the triangle, and the base. We actually had an individual last semester who had pterygium. It was interesting. There's the head, the point of the triangle, and the base. It's a disruption of the connective tissue, and it's going to grow towards the cornea. That's what it looks like. Kind of looks like a wing, doesn't it? I think. Cornea. So these are things that we will cover. Once again, anatomy. We're going to do the cornea. So we did the eyelids. We did the conjunctiva. Now we're going to the cornea. What's the cornea? The cornea is the extension of what part of the conjunctiva? Bulbar or palpebral? Bulbar, yes. Bulbar. Said it with confidence. I'm not going to hold you responsible for onchocerciasis. Corneal dystrophy, there's one there. Band keratopathy. We'll go over that. All right. So now I'm going to go over this once and once only. Here is on the top, superficial. Here's the cornea right here. So we're going from superficial to deep. Please pay attention. Here's your epithelium. This is your corneal epithelium. Bowman's membrane. This is all your corneal stroma. This is your stroma in general. Descemet's membrane and endothelium. So from superficial to deep. All right, so please pay attention to Descemet membrane and endothelium because that's where we'll spend majority of our time. So cornea. 5 layers, herpes. Now, micros covered herpes, you know the intricacies of it. Not a very pleasant virus, or is there such a thing? Primary, asymptomatic. Ulcerations, not common. Ulcerations are not common. Secondary, yes. All right, reactivation. Reactivation, secondary. Ulcers are common now. I need you to pay attention to the presentation of herpes, please. So, who is it going to affect? Is it the conjunctiva? No, where are we? We're in the cornea. Okay. You guys with me back there? Dendritic ulcer. So we're still doing the herpes. This is the presentation of herpes. What is a dendritic ulcer? Well, morning. Superficial punctate keratopathy. Basically what happens is that you have initially the infection, and then you will have lesions. Okay. Superficial punctate. What does punctate mean? Punct means pinpoint. All of these little lesions will coalesce. They'll come together. And when they do, it forms an arborization or branching or tree. Dendritic. When was the last time you saw a dendrite? Neurons? What does dendrite mean? Tree branching? All right? Same concept. You'll see this over and over and over in medicine. So you have a dendritic ulceration. What does that mean? Once again, all the punctate lesions are coming together to form one huge fissure. Okay? And if we were to take a look at this on a slit lamp, it will look like arborization, a branch. Okay? It's a dendritic ulceration. Does everyone understand that? All right. Now, descemetocele. What does that mean? Seal in general. You've seen varicocele, so on and so forth. Basically an inflammation. This is reactivated HSV, herpes simplex, reactivation. Okay. So what ends up happening here is that the Descemet's membrane becomes extremely weak, and then you have fluid. Who's behind the cornea? You have fluid back there? Yes, absolutely. There's aqueous humor. So if the Descemet's membrane or the endothelium gets disrupted, The seal, just like any type of other seal, like varicocele, whatnot. What do you see? You see inflammation, the fluid going in. Where is that fluid going into? The stroma. And that's what that is. The picture on your left. Okay, reactivation. And what type of presentation, what type of lesion would you see? What's a pattern? Dendritic. All right, which of the following is an example of HSV keratitis? Any takers for one? Well, based on what you know for HSV, what is the presentation going to look like? Yell out a number. You should know this. Which one looks like an arborization? Which one looks dendritic, do you think? Number 3. Yeah. Number 1 is vitamin A deficiency. Number 2 we'll get to, hypopion. Number 3 is HSV. Number 4, unfortunately, the individual was given wrong medication. Amazing. All right, so we're not going to cover onchocerciasis and band keratopathy. Chronic inflammation. Chronic inflammation, and what you need to know is that it is deposition of calcium phosphate. Okay? Band keratopathy. Brownish staining. You see it quite a bit with, what condition would you see Kaiser-Fleischer rings with? Yeah, there you go. Exactly. Wilson's disease. Okay. You see band keratopathy. All it is, where are we? This is the cornea. Deposition of calcium and phosphate. Corneal dystrophies. What is the bottommost layer? What is the deepest layer of the cornea? Is it going to be epithelium or endothelium? Endothelium. And what type of membrane is superficial to the endothelium? Desmase membrane. All right. This is where we're going to hone in on. All right, so as far as corneal dystrophies, you have 5 different layers of the cornea, so let's go through the layers. However, epithelial, I will not hold you responsible for. Obviously, there are epithelial corneal dystrophies. Stromal corneal dystrophy, I will not hold you responsible. Obviously, the stroma is the thickest part. Now let's go to endothelial. FED, Fuchs, endothelial, not epithelial, endothelial. Deepmost part of what? The cornea. All right, I'm waking up. All right, so deepmost, FED, Fuchs, endothelial dystrophy. Mutation, type 8 collagen. Pretty important to know this one. All right, now let's talk about the mechanism. What is all this about? Dystrophy, degeneration, dysfunction. Dysfunction of what? Well, if you take a look at the bottom right picture, what did I say was deep to the cornea? What type of fluid? Aqueous humor. Yeah, exactly. But I mean, do you usually find that in the cornea? I mean, is it a liquid? No, absolutely not. It's a solid, for Pete's sakes. If it's solid, then who in the world is keeping the fluid out? There's a pump. You see that pump? Endothelium. The desmase membrane. All that stuff needs to be working properly so that it can keep the aqueous humor out of the cornea. This is important.